A drug administration chart is used to record and track the administration of medications to patients, detailing drug name, dosage, frequency, route of administration, and the time given. To record items in the drug administration chart, follow these steps. Select the patient in admission as shown. Click on Actions and select Drug Administration Chart. In the subsequent window, fill in the required details. If you are prescribing from a location other than the pharmacy, check the Change Storage Location checkbox and select the appropriate storage location. Select the drug from the drug name list. The dosage unit and dosage form will be automatically indicated based on the item registration in the inventory, but you can edit them if necessary. You can change the billing scheme, adjust the dosage start date if necessary, and check the Start Dose checkbox if this is the initial dose. Indicate the route and the strength of the dose. Input the quantity and select the frequency of the dosage from the drop-down. The window to indicate the specific time will pop up as shown. Enter the time when the medication should be administered. It helps ensure proper dosing intervals, preventing underdosing or overdosing. Click on the Select button to save. Input the duration of the medication. A total quantity will be auto-filled as shown. Specify whether it is in days or weeks. The Other Instruction section provides additional details that the healthcare provider wants the patient to follow beyond the standard dosage instructions. Click on the Save button to save. To bill and dispense the inpatient drugs on the drug administration chart, follow the following steps. Select the drug on the drug administration chart from the prescribed drugs section as shown. For the start doses, they will be displayed on the once only, stat, and pre-medication prescription section. For the regular doses, they will be displayed on the regular prescription as required prescription section. Right-click on the item and select Bill and Dispense. Confirm by selecting OK on the prompt that appears. Items that have been billed and dispensed are color-coded in blue. This ensures that the drugs are added to the patient's bill and dispensed from the storage location. To administer the drug item, right-click the billed and dispensed item and select Mark as Dispensed. Confirm by selecting OK on the prompt that appears. In the new pop-up window, adjust the administration date and time if necessary and select Mark. The administered drugs are color-coded in green as shown. Inpatient prescriptions can be discontinued on clinical orders. To discontinue a drug means to stop administering the medication to a patient due to reasons such as adverse reactions, ineffectiveness, or a change in the treatment plan. To discontinue a drug item, right-click on the prescribed drug as shown and select Discontinue Drug. Confirm by selecting OK on the prompt that appears. The discontinued drug administration items are color-coded in red. When you discontinue a drug on the drug administration chart, the system will automatically void the items on the inpatient's bill and return the stock quantities to the particular storage location. To view the drug administration report, click on View Report on the drug administration chart. In the new report window shown, you can share the report via email, download in the different available formats, or print the report.